the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila. The beneficiary of this event is the UP PGH, Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/newwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at New Webinars, and YouTube at tinyurl.com/newwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the affirmation platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and/or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MuWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and/or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the affirmation platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/mewwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MewWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
God our Father, we come to you in our need to ask your protection against the COVID 19 virus that has claimed lives and has affected many. We pray for your grace for the people tasked with studying the nature and cause of this virus and its disease, and of stemming the tide of its transmission. Guide the hands and minds of medical experts that they may minister to the sick with competence and compassion, and of those governments and private agencies that must find cure and solution to this pandemic. We pray for those afflicted. May they be restored to health soon. Grant us the grace to work for the good of all and to help those in need. Grant this through our Lord Jesus Christ, your Son, who lives and reigns with you in the unity of the Holy Spirit, God, forever and ever. Amen. Mary, help of all Christians, pray for us. Saint Raphael the Archangel, pray for us. Saint Roch, pray for us. Saint Lorenzo Ruiz, pray for us. Saint Pedro Calungsod, pray for us.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM live stream.
The title of this forum is Mastering Menopause, Going Through the Change. Pagbabagong pinagdadaanan ng lahat ng kababaihan, usapan ukol sa menopause. Today's forum aims to tackle concerns regarding menopause as physiological occurrence in female population. For today's forum, we have Dr. Anna York Bondoc with us again, a pulmonary oncologist, surgical and medical intensive care physician, and a former congresswoman for Pampanga's 4th District as our moderator.
Hello and magandang tanghali po. Thank you for joining us today. It's a Tuesday. And welcome again to the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, the Mu Sigma Phi Foundation, the UP College of Medicine, the Philippine General Hospital, and the City of Manila. This health forum is a series of panel discussions that addresses common occurrences and concerns of women as they pass through the different stages of life. So today, port na po tayo sa ating series, and our topic po is on menopause or mastering menopause, passing through the change. So we'll welcome your questions later. Please put them lang po sa chat box ng Zoom, or if you are listening through the FB Live, you are welcome to put your questions. And we have two distinguished speakers and a very distinguished reactor today. So ngayong hapon po, pag-uusapan po natin ang menopause. So let's start na po. So to formally start the webinar, we will introduce our speakers. Our first speaker today is Doktora Debbie D. Meguizo of the UPCM, or the UP College of Medicine class of 1996. Doktora Debbie specializes in reproductive endocrinology, infertility, and menopause. And she is currently working as an IVF or infertility consultant in the Center of Advanced Reproductive Medicine and Infertility at St. Luke's Global in BGC and Victory ART Philippines in Makati. So apart from being a very busy clinician and a mom of three, including one who's already a med student, which you cannot believe kasi ang bata ho ng mukha ni Doktora Debbie. Doktora Debbie is also the current Vice President of the Philippine Society for Reproductive Medicine and is an assistant professor at the St. Luke's Medical Center College of Medicine. So she's a very busy OB-GYN and we are honored to have her today with her specialty po in IVF, menopause, and reproductive endocrinology. Let's welcome Dr. Debbie B. Meguizo of the Mu Sigma Phi Sorority Batch of 1996, one of our silver jubilarians. Dr. Debbie, ready na po ba kayo?
Yeah, thank you. Thank you very much, Dr. Anne. Can I share my screen, please? Okay. Can you see my screen? Can you see my slides, Dr. Anna?
Yes, malinaw na malinaw.
Okay. Good afternoon, everyone. Thank you to the Mu Sigma Phi Sorority for inviting me to talk about menopause. We take menopause lightly, but in reality, changes during menopause affects daily activities and productivity in women. My goal this afternoon is to make everyone see how menopause can change the outlook in life of these women and how we physicians can give and advise our patients the possibility for a much better quality of life. So let us start with the stages of reproductive aging. This is summarized by Harlow and his group into 10 parts. Our concern in today's lecture will be stage -2 onwards, wherein symptoms of menopause sets in from declining fertility, menstrual irregularity, and now the vasomotor symptoms of menopause. The average age of onset of perimenopause is around 46 years of age, and it's usually range from 39 to 51 years of age. So what happens with menopause? There is a decrease in the ovarian follicles. With this, there will be a decrease in the granulosa cells that will decrease the production of estrogen as well as inhibin D. With this, it would lead to a negative feedback to the pituitary, increasing the FSH and LH. Thus, there would be hypothalamic aging for these patients. And with a decrease in the estrogen, the mucosal layer of the urogenital area atrophies, and this thins and loses its elasticity. There's also an increase in osteoclastic activity, leading to bone loss. Estrogen has a positive effect on the tunica intima, allowing vessel flexibility. With a decrease in the estrogen, there will be an increase in the intima and media thickness that can lead to vasoconstriction, an increase in the low-density lipoprotein, and an increased risk for cardiovascular diseases. Thus, the symptoms come in. We have vasomotor symptoms like hot flushes, night sweats, palpitations, and even migraines. This happens in patients, 85% of cases of menopause patients. We may also have the genitourinary symptoms, and this would be from the vaginal and urethral atrophy that can lead to recurrent UTI or sexual dysfunction. There could be psychogenic symptoms, which is mood swings, anxiety, depression, insomnia, or even loss of self-esteem. What happens when you have hot flushes? Hot flushes consist of severe sweating and peripheral vasodilation. This can be triggered when the core body temperature reaches the upper threshold. So what happens in menopause is that the core body temperature is more pronounced and the thermoregulatory zone is narrowed. So any change in temperature can lead to a trigger for hot flushes. Aside from this, there is also an increase in obesity and alters glucose metabolism that can lead to an increased risk for diabetes and related disorders. There's also altered lipid metabolism that can lead to an increased risk for the cardiovascular diseases and related disorders as well. So before starting menopausal hormone treatment, we have to consider the age of our patient, severity of the symptoms, cardiovascular disease risk, or breast cancer history of this patient. It is not longer recommended for the prevention of chronic disease. However, there have been studies showing that the use of estrogen within the first 10 years of menopause showed a reduction in the risk of cardiovascular disease as well as mortality. Thus, healthy peri-postmenopausal women with menopausal symptoms within 10 years of menopause, less than 60 years of age, benefits menopausal hormone treatment. And this can be done, or this can be given for a duration of 3 to 5 years and can be continued for women more than 60 years of age as long as the benefit outweighs the risk. The gold standard for the most common symptoms of menopause, which is the vasomotor symptoms, is menopausal hormone treatment. This relieves the symptoms, and it's best started, as we've mentioned earlier, at 50s or within 10 years of menopause. It improves the cardiovascular disease, cognitive function, and reduces the risk of osteoporosis. These are the different regimens that we can use for hormone treatment in menopausal women. We can give them estrogen as there's a lack of estrogen, but what the estrogen that we use is actually less potent compared to that we use with oral contraceptives. So these are the conjugated equine estrogen, 17 beta estradiol or estradiol valerate. It can be orally, in transdermal patches, or in gel form, or even vaginal form. If patients have a uterus, we don't want to risk endometrial hyperplasia. Thus, progestogens are added. And this could be in the form of dydrogesterone, micronized progesterone, medroxyprogesterone acetate, norethindrone acetate, drosperinone, or levonorgestrel intrauterine device. If patients are contraindicated in taking estrogens or progestogens, we can start these patients with tibolone or selective estrogen receptor modulators. Estrogen relieves the menopausal symptoms. They are neuroprotective, they can improve libido and protects the bones. However, they do affect the endometrium. It can lead to endometrial thickness. Breast density will be increased and weight gain for these patients. Oral estrogen has to pass through the first pass effect of the liver. Thus, it has been avoided in patients with hypertriglyceridemia, active gallbladder disease, in cases of thrombophilia, example in patients with factor V Leiden mutation, or venous thromboembolism history. In these cases, transdermal estrogen will be better. Vaginal estrogen could also be given, especially for patients with genitourinary symptoms, and this also decreased the risk for recurrent UTI. As we've mentioned, when patients have intact uterus, to reduce the risk of endometrial hyperplasia, progestogens are added. This can be given sequentially or continuously. Sequentially, it has to be given once a day for 12 days in a month. This is to remove the endometrial thickness to allow withdrawal bleeding for this patient. It could be given in a form of micronized progestogens at 200 milligrams once a day for 12 days every month, or medroxyprogesterone acetate 22.5 milligrams once a day. For patients where you use it continually, you can give it at 100 milligrams once a day continually. But progestogens is not indicated in women without uterus except in cases wherein patients have endometriosis, early stage adenocarcinoma, or endometrioid tumors of the ovary, or supracervical hysterectomy, wherein there's a possibility that there's still endometrial lining present in that area. So I've mentioned about the cyclic and the continuous use of menopausal hormone treatment. It's best to use the cyclic regimen wherein you use progestogens every month for 12 days for patients who are early menopause or perimenopausal for the first less than 2 years of menopause to allow withdrawal bleeding. For patients who have been menopause for a while or more than 2 years, the continuous combined menopausal hormone treatment would be an option. So these are the different available treatment or menopausal hormone treatment we have. The oral form, what we have here is the estradiol valerate, the conjugated equine estrogen. Before there were some present, we have Prempro, which is a conjugated equine estrogen and the MTA. What we have is the estradiol drosperinone at present. For the transdermal form, we have the gel pump. For the vaginal form, we have tablet form in the form of Vagifem. For selective estrogen receptor modulators, these are what we advise our patient when estrogen progestins are contraindicated. So this could be in the form of bazedoxifene, which is for patients who are intolerant to progestogens because of the bloatedness or the mood swings. These are beneficial for the endometrium, the breast, the bones, and relieves the vasomotor symptoms. Or ospemifene, which is very effective for patients who have genitourinary symptoms. It's also protective for the endometrium, the breast, and the bone. However, it doesn't resolve vasomotor symptoms. Or we can use raloxifene, which is for the bone and the lipids, and also protective on the breast. However, it has a high risk for venous thromboembolism. Tibolone is a weak estrogen. It has a weak estrogenic, progestogenic, and androgenic properties. It is beneficial for the vasomotor symptoms and the genitourinary symptoms. For the breast, the endometrium, bone, and glucose metabolism. But this is contraindicated for patients who have history of stroke or for patients more than 60 years of age. And there have been studies showing that they can have a slight risk of breast cancer recurrence. They don't have or they have neutral effect for the cardiovascular as well as venous thromboembolism. Testosterone has been used for patients of severe dyspareunia. However, these are only given to patients who are postmenopausal. These are not advised in patients who are premenopausal because of the increased risk of breast cancer. It has to be used only for a short period of time. Max would be 6 months at most. So the risk and the benefits of menopausal hormone treatment would be as follows. It prevents osteoporosis. It can improve mood, neuroprotective, improves the vasomotor symptoms, improves the vaginal, dryness, and genitourinary symptoms. It can decrease the risk of new onset diabetes type 2, although it doesn't prevent it. It decreases atherosclerosis and decrease cardiovascular disease, especially when we start our patients early. However, it increased venous thromboembolism and increased risk for stroke. And in this condition, transdermal or vaginal route of the estrogen can be given. It increased risk for breast cancer, endometrial cancer, ovarian cancer. So for these patients, we also add progestogens to decrease this risk. It decreased colorectal cancer and it can benefit. The benefit persists after 4 years of stopping the pill or the menopausal hormone treatment. It increased gallbladder disease. So if patients cannot tolerate or cannot take estrogen or progestins because of the contraindications, an option would be giving the non-hormonal medication. This could be in the form of selective serotonin reuptake inhibitor. It could either be paroxetine or fluoxetine, and this could reduce the vasomotor symptoms around 62 to 65%. Or venlafaxine or desvenlafaxine, wherein it can reduce 64%, or the anti-seizure medications in the form of pregabalin or gabapentin. Clonidine has been used as a patch, however, it only gives partial relief. Other options would be the phytoestrogen, which is a weak estrogenic activities in the form of isoflavone, which could be coming from the soybeans or soy products or red clover. Or there could be the black cohosh, the evening primrose oil, lubricants for vaginal dryness, ginseng, or dongquai. Cognitive behavioral therapy could be also offered to our patients in a form of hypnosis, acupuncture, yoga, exercise, psychotherapy, or even stellate ganglion blockade. The problem, though, they have shown little difference with placebo and they have conflicting results. So just to summarize the preferred treatment for patients who have different menopausal symptoms. So for vasomotor symptoms, it would be best to give estrogen progestin treatment. Same is true with patients having mood swings or depression with the addition of an SSRI. For patients of sleep disturbances, estrogen treatment would also benefit them, as well as those with joint aches and pains. For genitourinary symptoms, a vaginal estrogen form would be better for them. Migraine, transdermal estrogen will benefit these patients. For patients with cardiovascular problem or with moderate risk, we can give transdermal estrogen with micronized progestogens. But for patients of high risk, non-hormonal treatment is a better option for them. For patients of breast cancer, non-hormonal therapy would also be better for them. Ovarian or endometrial cancer for low risk, estrogen progestin treatment, intermediate to high risk, non-hormonal. For patients with premature ovarian insufficiency, low-dose oral contraceptive pills can be given till 50 to 51 years of age. Then we start this patient with menopausal medications. For patients with surgical menopause, we start these patients with a higher dose of estrogens, which is around estradiol of 2 milligrams orally or 0.1 milligrams of transdermal estradiol. Thus, when we have menopausal symptoms, we advise our patient then to start with menopausal hormone treatment in the form of estrogen treatment or estrogen progestin treatment. If patients are contraindicated in using this for patients with history of breast cancer or cardiovascular diseases, stroke, or VTE, we then advise this patient to either use transdermal, intravaginal, or even non-hormonal treatment. So alternative therapy at best have minimal effect, if any. Thank you very much and good day to everyone. Back to you, Dr. Anna.
Thanks so much, Doktora Debbie. Very comprehensive ang presentation ni Doc. Na-intriga na talaga ako dito sa hormone replacement. Marami na akong maitatanong later. So before we go, let's go on to our next speaker po. And this is Doktora Pauline Camacho-Almeda, or Doktora Ola, is an alumni of the UCM class of 1994. Doktora Pauline is also the past president of the American Association of Clinical Endocrinologists, and she's an author of numerous textbooks and a worldwide expert on osteoporosis and endocrinology. Ola is also a professor of the Loyola University Medical Center, and she is the director of their Osteoporosis and Metabolic Disease Center. Apart from this, she's also the fellowship program director of the Division of Endocrinology and Metabolism, also of Loyola. Paula is joining us from the United States, where she lives with her husband, Dr. Francis Almeda, who's also from UP 94, and three lovely daughters. Ola lives in Chicago, USA, and we are very honored to have her join us today. Thank you, Dr. Ola. Please, we are excited to hear your
Thank
lecture.
you. Thank you so much, Anna. So Anna and I were apartment mates during med school. So we have great memories from those times. Thank you, Jean. Thanks, Lilibeth and U Sigma Phi for this wonderful opportunity to share my knowledge about osteoporosis. It's something that I do and I've devoted my entire career to. Hold on, here we go, slideshow, there we go. So I'm going to be talking about postmenopausal osteoporosis, and we'll try to give a brief overview of management and treatment options. This is the guidelines that I authored with many other experts on osteoporosis. It was published in Endocrine Practice in 2020, and it was the product of many, many years of hard work for the entire team. Sorry. There we go. A conflict of interest. Our site, Loyola was one of the sites for the ARCH trial, which is the latest, this is for the latest drug on osteoporosis. So we'll talk about the epidemiology, pathophysiology of osteoporosis, talk about the initial evaluation and management, and what happens long-term. Very quickly, this is the bone remodeling cycle. And as you can see, one cycle of bone happens for about 3 months plus 3 weeks. And it's a process of bone breakdown as facilitated by these osteoclasts. So the osteoclasts eat up the bone, and then comes the osteoblasts, which lay down the matrix and facilitate the mineralization of bone. And that's why calcium is very important, because our bones are made up of calcium and phosphorus. So this is just another view of that same image that I showed, where you have the osteoclast. So our bones are comprised of these units. And if you look closely, you'll see these holes in the trabeculae of the bone. And this is what happens when you have osteoporosis. Notice that you have many more of these holes, many more osteoclasts, and they're also deeper. So the cavities are deeper. So that's how our bones get thinner. What happens to our bones during our lifespan, male and female? Peak bone mass for women is reached in our 20s to 30s, and it kind of stays steady until menopause. And as you can see, there's a rapid drop-off after menopause, lasting about 6 to 8 years, and then it tapers off. For men, there is no such thing, but they also lose bone mass steadily throughout their lifespan. So osteoporosis is very common in the United States. For adults over the age of 50, we have 10 million with osteoporosis and 43 million with osteopenia or low bone mass. That's about 54% of US adults. In Asia, it is projected that more than 50% of all osteoporotic hip fractures in the world will occur in Asia by the year 2050. And nearly all of the Asian countries fall far below the recommended amount of calcium. In fact, in the Philippines, India, Malaysia, calcium intake is below 500 milligrams per day. So just to give you an idea, a glass of milk is about 300 milligrams of calcium. So there's not that much dairy in our diet, and that accounts for this deficiency. There's also a widespread prevalence of vitamin D deficiency, even though, the Philippines is a tropical country. The fact that DEXA scan can be kind of expensive for the general population and is not widely available. So the keys to prevention of osteoporosis is to ensure that we have adequate calcium and vitamin D's during our lifetime, not only as postmenopausal women, but also as teenagers, as women in our 20s, 30s, and 40s. Lifestyle measures, these are avoidable and preventable. Avoidance of smoking, excessive alcohol use, and maintaining an active lifestyle. It's also very important to detect and correct causes of secondary osteoporosis, and I'll show you the workup that we usually do. And when osteoporosis is detected, early initiation of therapy and then the follow-through. So who should be screened for osteoporosis? It is a huge problem in postmenopausal women, and we recommend that women over the age of 50 should be screened. And screening does not always mean that you get a bone density test. You can use tools like FRAX to assess fracture risk. Bone mineral density or DEXA scan is recommended for all women over the age of 65 and women with a history of trauma, low trauma fractures, and other high-risk features. So even if they're less than 65. And also those who have known secondary osteoporosis. So this is the diagnostic criteria for osteoporosis. We're all quite familiar with this. T-score of negative 2.5 or below diagnoses osteoporosis. However, our guidelines expanded the definition of osteoporosis. So number one is the WHO criteria that I just showed. Number two would be any fracture of the spine or hip that results from low trauma. So this is good in the Philippines if your patients do not have access to bone densitometry. If they already have a spine fracture, they have the hump, dowager's hump, then they probably have osteoporosis. Thirdly, T-score that is between -1 and -2.5. So that's the osteopenia range. If they have these fractures, then they also have osteoporosis. And then lastly, I mentioned the FRAX score. FRAX, you can do this online. Anyone can do their FRAX score. Just Google FRAX. If your fracture risk probability exceeds the threshold for the country and you have osteopenia in your DEXA scan, then that's also osteoporosis. So I mentioned that evaluation for secondary causes is very important because this is seen in up to 1/3 of women with or without symptoms. The most common of these are disorders of calcium metabolism, such as low calcium malabsorption, hyperparathyroidism, hypercalciuria, vitamin D deficiency. And these are, Cushing's, that's rare. Too much thyroid hormone would be obvious. It will increase and accelerate bone loss along with our metabolism. So workup that we usually do in the bone clinic, CBC, we do a chemistry panel looking at the kidney function, looking at liver function, serum calcium, corrected calcium, vitamin D level. This is rare. We don't do this, but I also, on top of these four, I do a parathyroid hormone, TSH. If the patient looks like they could have malabsorption, then I add on screening for celiac disease. And also, if multiple myeloma is suspected, then you can do your electrophoresis. So non-pharmacologic management for osteoporosis is very important. I would say maybe almost close to the importance of pharmacologic therapy. For women 51 and older, we recommend 1,200 milligrams per day. So 1,200 includes the supplements and food. So if your patient loves calcium diet in their diet, milk, yogurt, then they may not have to supplement to that degree. Vitamin D, you can do 1 or 2,000 IU per day, but some people will just need much more vitamin D than that to maintain optimal levels in the 30 to 50. And then the rest of these are also very important. Weight-bearing exercises, smoking cessation, avoidance of alcohol and too much caffeine, and fall prevention. These are the drugs that we use for treating osteoporosis. The most common would be anti-resorptive agents. So anti-resorptive means they reduce bone breakdown. So here we have bisphosphonates, we have the SERMs, we have estrogen, calcitonin, and denosumab or Prolia. The second class are bone builders. So these are anabolic agents. And there's two drugs there, teriparatide, which is very similar to PTH, and abaloparatide, which is very similar to PTH-RP. And then we have the latest drug that was added, which is Ramoso-Jalbuena, also called Evenity. This is a totally different mechanism for treating osteoporosis. It's a monoclonal antibody against osteocyte-derived sclerostin. So in the guidelines, we talked about stratification. This is very important because not every patient with osteoporosis is the same. You don't offer the same drugs to every single patient. As you can see, for example, that this woman has a 19% fracture risk as compared to this lady who has an almost 43% fracture risk, so they're treated differently. An example of very high fracture risk would be someone who just recently fractured, particularly if it's a spine or a hip fracture. If they're fracturing while they're on treatment, or those who have had multiple fractures, and also those who are on drugs causing skeletal harm, or if their T-score is very, very low. So these are examples. In the guidelines, I talked about the stratification into the very high risk and high risk. So for high risk, it's perfectly fine to do oral bisphosphonates. So you can just do alendronate or risedronate. But in some cases, we need to go to injectable agents. So Prolia and zoledronate or reclass. So these are the two injectables. Then we have the alternative drugs. And then for the very high risk group, so for that Lola in the wheelchair, it would be recommended that she be started on injectable therapy because these drugs just give a bigger increase in bone density over a shorter time and a much more significant fracture risk reduction. So next would be just focusing on the high risk, because I suspect that in the community, in your practices, probably most of the patients that you see would be in this group. So high risk with no prior fractures, and yet they fulfill criteria for osteoporosis. So again, you can offer the oral medications, alendronate or risedronate. And if necessary, let's say they have gastrointestinal issues from the oral medications, then you may need to go to denosumab or zoledronate. So I typically don't go straight to denosumab for these patients because I think they will do just fine on the cheaper oral medications. So how long are patients treated? Very important. We don't treat patients forever. We ran into issues with atypical fractures and jaw necrosis many, many years ago. And now all the guidelines are recommending giving them cyclical treatment. So for oral bisphosphonates, this is for the high-risk group, not for the very high risk. You can treat them with oral bisphosphonates for 5 years and then start a drug holiday. If they are on zoledronate, then it would be 3 years followed by a drug holiday. For the very high risk group, by the way, it's going to be a longer duration. So oral can be up to 10 years. Of course, it doesn't have to last to 10 years. You can go up to 10 years. And if it's zoledronate, you can go up to 6 years. So very easy to remember, right? 5 and 10, 3 and 6. So who are candidates for bisphosphonate holidays? So that your patient cannot be fracturing. It is required that they are stable for the couple of years before you are going to stop the medication. So someone who just fractured last year or this year, I probably would not give them a bisphosphonate holiday. And there also should not be new medications, specifically glucocorticoids that can cause bone loss, or that they shouldn't have comorbid conditions that can suddenly increase their fracture risk. When do you resume treatment? Usually after there's significant decline in bone density, but sometimes they could have a fragility fracture when they're off treatment, and that signals the need to go back on treatment. I also use bone turnover markers. I use bone alk phos and C-telopeptide, and those usually go up when they're off drug. And when they're rising to almost pre-treatment levels, then it's probably time to get back. So this is the new drug, romosozumab, Evenity. It was approved in 2019. It's reserved. I usually use it for the most severe forms of osteoporosis. It's given as a subcutaneous injection for 12 months. So 12 monthly visits for injections. There's a black box warning. Do not use it for patients who had an MI or stroke in the previous year, as there was a slightly higher risk of cardiovascular and cerebrovascular events. Not sure what the mechanism. So we all have, I'm sure, patients who are on Prolia, or maybe there are patients out there who are on Prolia, which is denosumab. One thing that's very important here is you have to stay on schedule. There were reports of patients who had multiple vertebral fractures upon stopping of Prolia. And usually this can occur as early as 3 months after a missed dose, or as late as 8 to 16 months. I usually transition patients with 1 infusion of zoledronic acid or 1 year of an oral bisphosphonate before stopping. So the patient has to be stable, and it's up to the clinician, or of course in consultation with the patient, to assess that they're ready to discontinue. And a usual scenario there is when their bone density gets so good that they're no longer in the osteoporosis range. So you can start to think about transitioning off. So I wanted to keep this short so we have a lot of time for questions. But I talked about that successful therapy for osteoporosis relies on early detection, initiation of therapy. I need to stress that secondary workup is very important, because sometimes the drugs don't work well in the setting of issues such as vitamin D deficiency or calcium deficiency. Thirdly, that there are different kinds of patients with osteoporosis, and the choice of treatment depends on their fracture risk. So with that, I want to hand it over back to Anna so we can do our Q&A. Hmm. I cannot hear Anna. I think Anna's muted.
Okay. Thank you so much, Dr. Paula, for that comprehensive discussion on osteoporosis. Ang dami na nalaman na bago. Ang dami palang bagong drugs, and we will ask this later on. But meanwhile, before we do the Q&A, we're happy to be joined by Miss Rachelle Diaz. Rachelle is a graduate of De La Salle. She's an electronics and communication engineering graduate. But very interestingly, she is the co-founder of the longest-running award-winning food and travel blog in the country. Ako po ay sumusunod dito. This is called Our Awesome Planet. So she is known online as Mrs. Awesome Planet. Rach is also the mom of 4 active boys. They are Aidan, Joshua, Raphael, and Yuji. She is also the inspiration and secret weapon behind the successful campaigns to promote the food and travel secrets of a destination. She loves to make her own soap, shampoo, and other things. Mahilig pala sa DIY si Ma'am Rachel. So during this COVID pandemic, she discovered playing crypto games, dancing Zumba, while living an awesome life in Christ. Very interesting itong short intro natin kay Ma'am Rachel, and I'm very interested to hear her reaction. Let's welcome Miss Rachelle Diaz, Mrs. Awesome Planet. Thank you, Ma'am Rachel.
Hi, good afternoon to all the people listening. And after the sharing of Dr. Debbie and Dr. Pauline, I had so many questions to ask, and it was very informative, and it became a jump start for me to really look into the menopausal and osteoporosis issues, because I am already 48 years old. Hindi pa naman menopausal peri-peri, 'di ba? So I need to prepare myself um for this experience. So being a woman who has many challenges from pregnancy to giving birth, and I speak from experience. As mentioned by Doktora Anna, I gave birth to 4 boys, and it was a non-stop ride of getting pregnant, giving birth, and nursing my kids until I dropped. As in, until they gave up. I really I did not give up nursing them, but they were the ones who said para ayoko na. So I know it has a calcium effect on my bones. So now I understand. So I guess my mom was preparing me for this, because she was giving us, all of her 7 children, milk every day of our lives until we are under her roof. So it has been 7 years since my non-stop ride, because I have a bunso, 7 years old na siya, and now I am preparing for my menopausal period. How time flies, really. Biglang magme-menopause na ako. Actually, I think my husband is the one preparing for this. Those mga effect ng menopausal. I remembered when I was growing up, I would visit my grandmother and see her crouch and getting smaller and smaller. Yun din pala ang effect nun, because during their time, the more the merrier. So 9 children. I have 9 uncles and aunts in my mother's side. So maybe because they didn't have adequate calcium intake, or minimal knowledge of those effect of the childbearing, and on how to improve calcium intake and those effect. So so now I really realize that I need to take care of myself as well. So with this, I have several questions for Doktora Debbie. Doktora Debbie, um, how, wait let me recently I've been experiencing mainit, mainit. Mainit naman talaga sa Philippines. But how can you differentiate the hot flashes and feeling hot due to the weather? Sabi mo it would have a different temperature. Magiging para bang may fever ako? Ganun ba 'yon? Or
Actually,
ano
hi,
ba?
Rachelle. No iba kasi, when you talk about hot flashes, even if it's cold, even if you have aircon, naka-aircon kayo, everybody's cold, feeling cold, but you are feeling hot. That's when you have hot flashes. It's a different thing. If you're under the sun, you feel warm, that's normal. But when you're in a cold area, cool area, and then you feel hot, suddenly you feel hot, and it will just last a few minutes. Then you feel you're sweating, then that's what you call hot flashes. Yun yung difference.
Oh,
You
okay.
really feel it. Even if you're sleeping, that's the reason some patients may have insomnia. You're sleeping in an air-conditioned room, and then suddenly you wake up, and then you feel so hot, you feel sweaty. It will just last for a few minutes, and then after that, when everything's gone, you feel so cold naman. So you're shivering naman. So that's what hot flashes is.
What about the UTI you mentioned? How do we avoid getting the UTI? And ako kasi as much as possible, I don't want to give antibiotics kasi that's the cure for the ano, 'di ba, UTI and recurring UTI. How do you avoid that?
You have to check first what's the cause of your UTI. Because the main thing is when you have recurrent UTI, there could be some reason. You have to rule out first for diabetes, for other problem. But menopausal women do have recurrent UTI. It's because of the dryness. There would be the dryness of the vaginal area, not just the vaginal, also the genital portion where the urethra is. So because of that dryness, you're more prone to having infection in that area. So that's the reason why you have recurrent UTI in menopausal women. So we advise our patient to use more of the moisturizing soap. It's not as dry as it should be. And if there's a need, you may have to use vaginal estrogen. That's the hormones that you use for menopause to decrease this risk.
Okay, thank you. About this menopausal baby. Ito usong-uso to sa mga friends ko, yung mga parents nila nagkaka-menopausal baby. So, until what age can you be fertile? How will you know if you're fertile if your cycle is not regular already? So, basically, how do you define having irregular menstruation? For me, I don't know if this is irregular. Lately, it's siguro 1 year na, my period gets pushed back 5 to 10 days every month. So is that irregular menstruation already?
You
That
have your menses regularly pa rin, eh. You have it every month. So that's technically you're still regular. Although when you say you're nearing, because when you talk about perimenopause, you just have to remember the 10 parts, the 10 stages of the reproductive aging. So when you're nearing menopause, your menses becomes less often. So which means that instead of 30-day cycle, nagiging every 40 days, naging every 60 days, eventually, mga ano na lang, every other month na lang yung menses mo. So it's becoming lesser frequency yung menstruation. So that's what we call irregularity of your menses. But the fact that you're still having your menses, it could still be a sign that you're still having ovulation. You have follicles, and there's a possibility for you to get pregnant still. So when you talk about menopausal babies, hindi pa talaga menopause kasi nabuntis ka pa rin. You still have the release of the egg. So you can get pregnant. That's also the reason why at this stage, we don't give just the menopausal hormone treatment. We give this patient oral contraceptives kasi they can get pregnant at this stage. So that's around mga 45, 46, ganon. They're not very fertile, which means that they can't get pregnant immediately. but there is a chance for them to get pregnant pa rin. So we don't give menopausal hormone treatment. We give them low-dose oral contraceptive to prevent them from getting an unwanted pregnancy. Uh, I,
Ayan, ang ganda. Thank you so much.
Dami.
Ayan. Ang gaganda ng mga tanong ni Rachel. Ang ganda. Well, let's ask naman si Doktora Ola. May tanong po dito that we received. Dear Doktora Pauline, considering the Philippines is tropical country, hindi ba pwedeng magpa-araw lang para pwede na yung vitamin D makuha namin? Is that enough to prevent osteoporosis? No, maraming magagalit na tanong na to.
Okay, so good question.
Ayan, considering the yes.
You know, ang downside, yes, you can get vitamin D from sunbathing. In fact, they say one sunburn now is almost equal to like 20,000 international units of vitamin D. But there's a downside, you can get skin cancer. So I think it's a pretty risky thing. Early morning sun, 15 minutes, of course, that will help. But when they've done studies on even farmers or people who live in tropical countries, I don't know why, maybe the ozone layer or what, mataas din ang prevalence ng vitamin D deficiency. So vitamin D, it's very safe to take 1,000, 2,000 kahit na you don't get your levels checked. So I would just do it. I have my mom on vitamin D. She's there in Bataan. And you know, you can feel safe. You can feel safe na that'll get you to a pretty good level.
Madami pumasok sa
di ba?
alam mo, Doc Ola, surprisingly, kasi we have fertility patients, we check their serum vitamin D, ang daming mababa. Here in the Philippines,
right, exactly.
It's low. Even with that.
I think it's in the environment or nutritional deficiency, ganon. But even, among farmers or this guy, the expert here, Neil Binkley, he did a study among Hawaiians, mataas din. And you guys have seen it. So it's not enough to just go out there and spend time in the sun. Not good for your skin too.
Agree ang mga derma dito. Thank you, Dr. Pauline, for that. Ato for Dr. Debbie naman, who should we start on hormone therapy? Like, and when should we start as a primary care physician? Lahat ba dapat ng nagmo-menopause bigyan na lang ng hormone therapy o paano po ba?
Actually, the recommendation right now, it's not to start it. It's not to start routinely the hormone therapy, only when patients have symptoms. When patients have symptoms of menopause, most commonly is the vasomotor symptoms, the hot flashes, the migraine. So we can start it early on. The earliest you start it, even before menopause, the greater the benefit for these patients. So we want it earlier. But may symptoms.
Okay.
Kapag wala, don't give it.
How about if your sex life is boring? Should you start hormone replacement? Or kung nahihirapan ka to have sex? That would be a better question.
Of menopause, that's actually genitourinary symptoms of menopause.
Ito hindi nila alam yun.
That's a common problem. That's a common problem of patients who come in because of sexual problems, dysfunction. Talagang, it's because of the dryness. Because of the dryness, it's painful. You have dyspareunia. It's also it will decrease your libido as well as your husband's. Kasi pati husband will have difficulty because of the dryness. So, yes, it would now be an indication for you to give menopausal treatment for this patient. Kahit vaginal, you can give it. Yeah.
Okay. Thanks, Dr. Debbie. Miss Rach, may tanong ka pa ba? Ang gaganda ng mga tanong ni Miss Rach.
Hindi ako nagtanong nun maski apat na yung anak ko
Okay, good. Do you want to ask anything, Ms. Rach?
Yes. Doktora Pauline, ito. So, yung osteoporosis ba, may effect ba dahil, kunyari ako, 4 na anak ko, versus a person na may 2 anak? Dun, may difference ba yun? Yung mas mababa yung ano ko, yung nag-weekend yung bone ko, tapos nag-breastfeed pa ako, ng todo-todo. So, may effect yun.
I think that for sure, if you were measuring bone density, during pregnancy, which we wouldn't do, and while you're breastfeeding, nagsasuffer ng konti yung bones if you're not able to maintain sufficient calcium intake. But generally, after you stop breastfeeding, kasi you're still young, you're not in menopause yet, maaring mag-recover ng konti yung bones, provided you're not deficient until your next pregnancy. Kasi if you have naman like 9 children and then sunod-sunod, breastfeeding, wala ka ng rest time. The bones don't have enough time to rest. So conceivably, merong effect if you have many kids that you've born and breastfed. But kung dalawa lang, or even for you, if you did well with your calcium supplementation after your pregnancies, maaring mag-recover pa yung bones. But compliments to your mom for giving you guys milk. She's ahead of her time.
Yes. May question pa.
Okay, thanks. Sige.
Sorry.
Rach.
Kasi po na-mention nyo 1,200 milligram of calcium for less than 51. And so hindi totoo yung may nababasa kasi akong pag kunyari 60 years old ka, mag-calcium ka, useless na, wala nang effect yun.
No.
So what's your take on that?
No, all the way through, even into our old age, there's a basic amount ng mineral that we have to maintain, right? Just like we need potassium and all those things, it's a nutrient. So we need calcium for bone health. And what happens is, even the older you get, if you're deficient, then your bones will actually give up calcium to maintain the levels, right? So storage kasi ng calcium ng bones, whenever our body feels na there's not enough calcium, then the bones will get thinner. So hindi totoo that you should not take calcium when you're older.
Ayan. Thank you, Pauline. Thanks, Doktora Ray. Thanks, Rach, for this question. May nagtanong po dito. I think this is maybe a primary care. Tinatanong niya, if osteoporosis is a lifelong disease, why would we stop after 5 years? Bakit? Why would we stop? Oo.
So I don't know if you remember, but around 2000s, mid-2000s, may lumabas in the news about people on osteoporosis drugs who were getting osteonecrosis of the jaw, and also some reports about atypical fracture of the femur, yung bigla nilang magbe-break yung femur. So the thinking there is that they're actually exposed to the drugs too long. There's a problem with these drugs if they're used for too long of a duration. Parang na-over-suppress yung bones. So the cyclical treatment allows the bones to recover para ma-reduce yung incidence of those rare adverse events. And the thing about the drugs that we use for osteoporosis, they actually hang around the bones for a long time. Even if you stop them, you'll still have an effect a year later, 2 years, 3 years later, or beyond. So that's why we're able to do drug holidays. Hindi siya permanent discontinuation. They're holidays lang yan, rest period.
Okay. Thanks, Dr. Pauline. For Dr. Debbie, may tanong po dito. Please tell us about male menopause. Ewan ko kung topic ni Dr. Debbie to. But Dr. Debbie, tell us about male menopause kung meron man. O baka dapat urologist yung guest natin.
Sorry, I can't hear so much. Hello?
Male menopause, Dr. Debbie. Meron ba?
Actually, we have that. It's actually known as andropause. When you have male menopause, that's andropause. So in andropause, there is a decrease in testosterone levels. So with a decrease in the testosterone levels, there could be some mood swings also, and there could be some loss of libido in these patients. So they do happen. Andropause do happen.
Doktora, naitigil ko
Sorry, can you
male
hear me?
hormone. Ano
Wala
yun?
ako.
Doktora, I'm just curious about the
Uh-oh.
science giving male
I
hormones.
can't hear. Wait.
Ah, okay na?
Oh, sorry. Is it me? Can
Okay,
you hear
okay
me?
na? Sorry ho na.
Can you hear me? Can you hear me?
Yes, I can
Hello?
hear you, Doktora.
Okay, sorry. So when you have a male menopause is andropause. We call it andropause, yung male menopause. And that do happen in our setting. So when you have andropause, there's a decrease in testosterone levels, although they do happen at a later time compared to female menopause. So when that do happen, it's more of the moods. They lost interest and even libido was also lower for these patients. So that do happen, andropause.
Okay. Thank you, Dora. Very interesting. Pero about men rin naman, Dr. Lee. Men lang, how do we screen males for osteoporosis at men ba ito for males?
Yeah. So they say about 20% of cases of osteoporosis worldwide are males. And the screening would be the same as for women, bone density or DEXA scan. But we don't recommend doing a DEXA scan on every male at a certain age. Usually may mga something to tip you off. For example, if they have a fracture, I think that's a reason to do a bone density test to screen. Or maybe they have low testosterone, which is one of the risk factors for males, or also other conditions, say high dose prednisone, ganon, mga risk factors. It takes a lot more to screen men for osteoporosis. Recognize also pala na if they have the curvature kyphosis, that could be fractures in the spine. And I think you should consider the possibility of osteoporosis, male
Ayan.
or female.
Thank you, Doktora Ola. One question, iba ba ang treatment ng males sa females sa osteoporosis? Or pareho lang?
Hindi naman. Some drugs, wala silang indication for male osteoporosis. But most of the drugs that we have for osteoporosis are indicated for both male and female. Obviously, hindi yung selective estrogen, hindi yung estrogen, but like the bisphosphonates, Prolia, Reclass, may indications. Forteo, may indication for male.
Ayan. Ayan. Thanks, Doktora Ola. And for Doktora Debbie naman, Doktora Debbie, I got so intrigued, and I'm sure everyone here, is there a link between menopause and mental health, and what should we do about it?
They have said that with menopause, there could be some psychogenic symptoms. So it's more of there's an increase in dementia, there's an increase in the it can be a problem with the psychogenic symptoms. But they have also shown, there have been studies, but there's controversial studies kasi that the menopausal hormone treatment can actually decrease this risk. So taking this can be neuroprotective. However, there's no randomized studies that can prove this. It has been iba-iba yung studies, iba-iba yung results. But the fact is, with this, it said that there's an improvement or there's a decrease in the risk of having mental conditions with menopausal medications, with the hormone treatment.
Ayan. So may link siya, it's possible. Okay. Ang daming matatanong, but we have to go to our last. Yeah. Ang dami talagang tanong. But we have to go to our last question. Maybe Rachel, would you like to ask the last question, Miss Rachel?
Um, ito. If your uterus was removed, would you experience menopause? Kasi may nakita rin ako sa slide mo, Doc, na may medication if uterus was removed. So,
Ano rin, uh, when you remove your ovaries, that's the time you feel the symptoms because it's the ovary which supplies the hormones. If it's just the uterus, there's really no problem. It's when you have your ovaries removed, then that's the time that you really need to have your menopausal hormone treatment, especially for patients who have an early removal of their ovaries. Because if they're young and they need to have a removal of both ovaries, they go into menopause at an early stage to protect them from having all these menopausal side effects, metabolism, the bones. You have to give them the estrogen therapy or estrogen supplementation to prevent them from having this problem. Except when ovary was removed uh, ovarian cancer, endometrioid ovarian cancer, or cases when you have um, the endometrial adenocarcinoma or endometriosis, then you don't just give estrogen, you also have to give the progestogen component of the hormone treatment to protect them from having this problem again, a recurrence of this condition. Did that answer your question, Rach?
yes, Doc.
Thank you so much. And with that, thank you, Rach, for the last question. With that, we come to the end of our Q&A, and we'd like to ask our speakers to give us a very short, yung mga nakikinig will, ano po ang gusto niyong take away sa aming nakikinig, both lay persons and primary care and internists who are watching us today. So, Dr. Pauline, gusto mo bang mauna to give us a last message and a takeaway on osteoporosis?
Oh, okay. So I think that we should be aware na osteoporosis happens. As Asians, we are high risk for osteoporosis, particularly if you look at your mom and lola, genetics is very important too. So I think early recognition, ask your physician to order a DEXA scan, make sure you're getting plenty of calcium and vitamin D for prevention and staying active. And if there's a problem, then see the specialist for proper treatment.
Yeah. So may pag-asa pa naman. And the point is you have to do something about it. Yeah. Thanks, Dr. Pauline. And Dr. Debbie, a takeaway po sa menopause.
Yeah, menopausal symptoms are really happening. You have to be considerate with people near you who may have menopausal symptoms, but they do happen. And if they have menopausal symptoms, there are solutions for this one. So you can start your menopausal hormone treatment as soon as the symptoms come out to improve quality of life. At the same time, it's protective also in your metabolism, on the bones, as well as psychogenic condition. So you start early, but this has to be continually monitored. And the advice is actually to keep this for around 5 years max. And if need be, to stop it at the age of 60, unless there's other symptoms or patient is healthy, you can continually take this one with caution.
Thank you so much, Dr. Debbie. These are our two distinguished speakers on menopause and osteoporosis, and it's been very informative, especially on the changes happening in one's body during menopause. It also shows us how to manage symptoms and how to start and when to start meds. So I hope lahat po na nakikinig ay nagkaroon po na maraming insights. So, ayan po. Thank you so much. Tapos na po tayo, and we would like to thank the MU webinar team of the MU Sigma Story, and like also thank our partners, the UP College of Medicine, the Philippine General Hospital, City of Manila, and this event would also not be possible without our co-presenters in Live Sheroes and the MU Sigma Phi sorority. Our co-sponsor is Novo Nordisk, and our official media partner, and I'm so honored to meet Mrs. Awesome Planet. Our official media partner is Our Awesome Planet. We are grateful for the unwavering support of the UP Manila Information Management Systems and the UP Postgraduate Institute of Medicine. And most of all, maraming sa nakinig and those who spent our lunch hour with us. Thank you, Doktora Debbie Meguizo, Doktora Pauline Camacho, and Mrs. Awesome Planet, Miss Rachelle Diaz. Again, we remind all healthcare professionals who are interested in obtaining CPD units to please fill out the evaluation form at tinyurl.com/MUwebinars 2021 eval within 3 days after the forum. And you will find the links for the evaluation forms at the comment boxes on FB Live, YouTube, and the chat box po ng Zoom. So we'd like to invite you for next month, the Doktora, the Dr. Julita Ramoso-Jalbuena Tuesday, entitled What Women Should Know About Advanced Cervical Cancer or Ang Dapat Malaman ng Kababaihan Ukol sa Advanced Cervical Cancer. And likewise, please support and participate in our year-long Women's Health Forum series. I'd like to mention the speakers for the cervical cancer talk. These are Dr. Jean Ann Toral and Dr. Caroline Zalameda Castro, and to be moderated by Dr. Gladys Facun. And Miss Frances Ang, the General Manager of Asian Ferriting PH, will be our reactor. So with that, I'd like to thank everyone for joining us and magandang hapon po sa inyong lahat. I'm Doktora Ana York Bondoc. And this is the MUla kay Doktora, Dr. Julita Ramoso-Jalbuena webinar series of the Mu Sigma Phi Sorority. Salamat po and magandang hapon po sa inyong lahat.
Thank you for attending the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
The Mu webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the In Life Sheroes and the Mu Sigma Phi Foundation, and co-sponsored by Novo Nordisk. And this event is covered by our official media partner, Our Awesome Planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinyurl.com/MUwebinars2021 eval. Please ensure that your answers are submitted within 3 days after the webinar. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. For more details and updates, please check our Facebook page at facebook.com/MUwebinars and our Twitter timeline at twitter.com/MUwebinars. You may also email us at mewebinars2122@gmail.com.
Before we end, we would like to invite you to the next leg of the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on October 26, 2021, Tuesday, from 12 to 1 p.m., entitled What Women Should Know About Advanced Cervical Cancer, or ang mga dapat malaman ng kababaihan ukol sa advanced cervical cancer, which will tackle concerns on advanced cervical cancer. The speakers will be Dr. Jean Tural and Dr. Kaka Castro, and to be moderated by Dr. Gladys Facun. We will also be having Miss Frances Ang, a blogger, as our reactor.
And likewise, we would like to invite you to participate in our year-long Women's Health Forum series. Thank you very much for attending this webinar. Have a good day.